If you have Medicare, specifically Part D, you may be able to get a weight loss medication for a lot less money. Well, let's discuss it. Hi, I'm Dr. Jeremy Briner, bariatric and foregut surgeon and obesity medicine specialist. In just 2 weeks on July 1st, the Medicare Bridge program will go live. This will allow anyone with Medicare, specifically Part D, to get a GLP1 medication like Wegovy or Zepbound for no more than $50 a month. This will be great for so many people, but there are some catches. Let's first talk about which medications will be covered. The 4 medications covered are Wegovy, both the injections and tablets, as well as Zepbound injections and the Foundayo tablets. So who qualifies for this program? Well, any adult whose BMI is greater than 35, any adult whose BMI is greater than 30 with at least one of the following: heart failure with preserved ejection fraction, uncontrolled hypertension. This means systolic greater than 140 and diastolic greater than 90 on at least 2 antihypertensive medications, or chronic kidney disease, specifically stage 3A or greater. And finally, any adult with a BMI greater than 27 with at least one of the following: prediabetes, history of MI or heart attack, previous stroke, or symptomatic peripheral arterial disease. Well, let's also talk about who does not qualify. Well, anyone whose BMI is less than 27, because you don't meet criteria for GLP-1 therapy. And if you have type 2 diabetes, you can still get a GLP-1 medication, but just through insurance as opposed to this Bridge program. Now let's talk about the caveats to the Bridge program. It's important to note that this fee of up to $50 a month does not go towards your deductible. This is an entirely separate program. This is especially important for people on the Medicare Extra Help subsidy. Normally, those prescriptions are capped at $5 at the pharmacy. This will not apply through the Bridge program. It's also important to note that this program ends December 31st, 2027. It will then transfer to another program called Balance. We just don't have a lot of details about that yet. So all of that to say, if you are someone with Medicare Part D and you meet criteria for these medications and the $50 a month is doable, this may be a great option for you. So I highly encourage you to talk to your physician about this. And if you have access, ideally an obesity medicine specialist. And if you have any questions about this program or these medications, leave them below and I'll be happy to answer them.